Cancer refers to any one of a large number of diseases characterized by the development of abnormal cells that divide uncontrollably and have the ability to infiltrate and destroy normal body tissue. Cancer often has the ability to spread throughout your body. Cancer is the second leading cause of death in the world, but survival rates are improving for many types of cancer, thanks to improvements in cancer screening, treatment, and prevention. The symptoms. Signs and symptoms caused by cancer will vary depending on what part of the body is affected. Some general signs and symptoms associated with, but not specific to cancer include fatigue, lump or area of thickening that can be felt under the skin, weight changes including unintended loss or gain, skin changes such as yellowing, darkening, or redness of the skin, sores that won't heal, or changes to existing moles, changes in bowel or bladder habits, persistent cough or trouble breathing, difficulty swallowing, hoarseness, persistent indigestion or discomfort after eating, persistent unexplained muscle or joint pain, persistent unexplained fevers or night sweats, and unexplained bleeding or bruising. When to see a doctor. Make an appointment with your doctor if you have any persistent signs or symptoms that concern you. If you don't have any signs or symptoms but are worried about your risk of cancer, discuss your concerns with your doctor. Ask about which cancer screening tests or procedures are appropriate for you. The causes of cancer. Cancer is caused by changes or mutations to the DNA within cells. The DNA inside a cell is packaged into a large number of individual genes, each of which contains a set of instructions telling the cell what functions to perform, as well as how to grow and divide. Errors in the instructions can cause the cell to stop its normal function and may allow a cell to become cancerous. A gene mutation can instruct a healthy cell to 1. Allow rapid growth. A gene mutation can tell a cell to grow and divide more rapidly. This creates many new cells that all have the same mutation. 2. Fail to stop uncontrolled cell growth. Normal cells know when to stop growing so that they just have the right number of each type of cell. Cancer cells lose the controls, which are the tumor suppressor genes that tell them when to stop growing. A mutation in the tumor suppressor gene allows the cancer cells to continue growing and accumulating. 3. Make mistakes when repairing DNA errors. DNA repair genes look for errors in the cell's DNA and make corrections. Many mutations in a DNA repair gene may mean that the other errors aren't corrected, leading to cells to become cancerous. These mutations are the most common ones found in a cancer, but many other gene mutations can contribute to causing cancer. Gene mutations can occur in these instances. 1. Gene mutations you are born with. You may be born with a genetic mutation that you inherited from your parents. This type of mutations account for a small percentage of cancers. 2. Gene mutations that occur after birth. Most gene mutations occur after you are born and aren't inherited. A number of forces can cause gene mutations such as smoking, radiation, viruses, cancer-causing chemicals, obesity, hormones, chronic inflammation, and the lack of exercise. Gene mutations occur frequently during normal cell growth. However, cells contain a mechanism that recognizes when a mistake occurs and repairs the mistake. Occasionally, when a mistake is missed, this could cause a cell to become cancerous. The gene mutations you are born with and the ones you acquire throughout your life work together to cause cancer. For instance, if you've inherited a genetic mutation that predisposes you to cancer, that doesn't mean you are certain to get cancer. Instead, you may need one or more other gene mutations to cause cancer. Your inherited gene mutation could make you more likely than other people to develop cancer when exposed to a certain cancer-causing substance. It's not clear just how many mutations must accumulate for a cancer to form. It's likely that it varies among other cancer types. The risk factors of cancer. While doctors have an idea of what may increase your risk of cancer, the majority of cancers occur in people who don't have any known risk factors. Factors known to increase your risk of cancer include 1. Your age. Cancer can take decades to develop. That's why most people diagnosed with cancer are 65 years or older. While it's more common in older adults, cancer isn't exclusively an adult disease. Cancer can be diagnosed at my age. 2. Your habits. Certain lifestyle choices are known to increase your risk of cancer. Smoking. Drinking more than 1 drink a day for women and up to 2 drinks a day for men. Excessive exposure to the sun or frequent blistering sunburns. Being obese and having unsafe sex can contribute to cancer. You can change these habits to lower your risk of cancer, though some habits are easier to change than others. 3. Your family history. Only a small portion of cancers are due to an inherited condition. If cancer is common in your family, it's possible that mutations are being passed from one generation to the next. You might be a candidate for genetic testing to see whether you have an inherited mutation that can increase your risk of certain cancers. Keep in mind that having an inherited genetic mutation doesn't necessarily mean you will get cancer. 4. Your health conditions. Some chronic health conditions such as ulcerative colitis can increase your risk of developing certain cancers. Talk to your doctor about your risk. 5. The environment. The environment around you may contain harmful chemicals that can increase your risk of cancer. Even if you don't smoke, you might inhale secondhand smoke if you go where people are smoking or if you live with someone who smokes. Chemicals in your home or workplace such as asbestos and benzene also are associated with an increased risk of cancer. Complications. Cancer and its treatment can cause several complications including pain, fatigue, difficulty breathing, nausea, diarrhea or constipation, weight loss, chemical changes in your body, brain and nervous system problems, unusual immune system reactions to cancer, cancer that spreads, and cancer that returns. Now, to the most important part of this video, the prevention. Doctors have identified several ways to reduce the risk of cancer, such as 1. Stop smoking. If you smoke, quit. If you don't smoke, don't start. Smoking is linked to several types of cancer, not just lung cancer. Stopping now will reduce your risk of cancer in the future. 2. Avoid excessive sun exposure. Harmful ultraviolet rays from the sun can increase your risk of skin cancer. Limit your sun exposure by staying in the shade, wearing protective clothing, or applying sunscreen. 3. Eat a healthy diet. Choose a healthy diet rich in fruits and vegetables. Select whole grains and lean proteins. Limit your intake to processed meats. 4. Exercise most days of the week. Regular exercise is linked to a lower risk of cancer. Aim at least 30 minutes of exercise most days of the week. If you haven't been exercising regularly, start out slowly and work your way up to 30 minutes or longer. 5. Maintain a healthy weight. Being overweight or obese may increase your risk of cancer. Work to achieve and maintain a healthy weight through a combination of healthy diet and regular exercise. 6. Drink alcohol in moderation if you choose to drink. If you choose to drink alcohol, do so in moderation. For healthy adults, that means up to 1 drink a day for women and up to 2 drinks a day for men. 7. Schedule cancer screening exams. Talk to your doctor about what types of cancer screening exams are best for you based on your risk factors. And lastly, ask your doctor about immunizations. Certain viruses increase your risk of cancer. Immunizations may help you prevent those viruses, including hepatitis B, which increases your risk of liver cancer, and human papilloma virus, which increases your risk of cervical cancer and other cancers. Ask your doctor whether immunization against these viruses are appropriate for you. Thank you very much for being with me to the end of this video. Drop your concerns in the comment section. Subscribe to my channel and share my video to your family and friends if you find it informative. Till we meet again, take a very good care of yourself. Remember, you can also make a difference. And don't forget, Kofi loves you. Peace out.